Hey, welcome back. I'm back in my reclining chair. Same chair from the last video, different room, and actually a different chair. I have two of these reclining chairs. This one's in my bedroom. So if I need to sit down, I can lean back and chill in here. Anyway, enough about my reclining chairs that we have all over the house. I thought today I'd talk to you a little bit about the medications I take and the prescriptions. I'm not going to go into detail on every single one, but some of these are fascinating and mostly the side effects are fascinating. But I do have some kind of crazy prescriptions too. So I thought I would share those. But this is basically what I take. And the mixture of all of that makes it hard on my brain. So these are for pain, muscle relaxation, asthma, migraine medicine, glaucoma, restless legs. I don't know, what else I got here? Anyway, there's a whole bunch of stuff in here. So, let's talk about the most interesting prescriptions that I've ever gotten. Well, there's two. The first one is also the largest prescription, and it is my hot tub. My hot tub was prescribed to me, and we went through the process with insurance to be provided as a medical device. They had never actually approved one as a medical device before, and it almost got approved, and would have been approved if we had done it during COVID. But because I was prescribed hydrotherapy, and there's a hydrotherapy spa tub at our Redmond Parks and Rec district. They said that was it within a close enough radius for me not to need one at my house. But you can still write it off on your taxes as a medical device. You just can't have your health insurance pay for it. If the same thing had happened during COVID when that hot tub was closed at Redmond Parks and Rec, it would have been approved. So that's kind of crazy. I mean, I don't think you can pick up your hot tub at Walgreens, but I don't know. Okay, the second craziest prescription I have for having permanent nerve damage in my back is I have a prescription for a shampoo. This is prescription shampoo. I'm trying to cover up my medical stuff. There you go. Anyway, so here's the deal on this. I think I told you in a previous video, when I'm in a lot of pain, my skin turns bright red. It gets really inflamed. And the longer I'm in pain, the more and more it inflames. Well, so it'll get really red and uncomfortable, like right through here on my face. But the weird place it gets really inflamed is right behind my ears. And it just burns. And so the way they treat it is with prescription shampoo. So when my back hurts, my face reacts, and then I have to use prescription shampoo on my ears and my face and my scalp to deal with the inflammation reaction. So if you've never met somebody yet, you have now, whose prescription for their back injury is shampoo. All right, next really cool side effect or interesting side effect is I use these prescription eye drops that I can't read because maybe you can read them. The words are too little for me. Can you read that? I don't think my camera's going to focus. But anyway, it's called like Lanthroprost or something. I can't remember. I'll try to figure it out and I'll put it in the notes below. But anyway, I take these eye drops every night to treat my glaucoma. I have glaucoma, which, can cause someone to go blind. For me, it's manageable with eye drops. One of the side effects of this medication is it makes your eyelashes grow really long. So like everybody I know who He's trying so hard to grow out eyelashes, get fake eyelashes, all that. If you're going blind, they'll give you eye drops for it. So another medical treatment that I have associated with my eyes that's interesting is I have a droop in this eye. And I haven't gone recently, but they put injections in my forehead here, very similar to Botox. It's not the same thing, to help hold the eye up. And so its side effect is my forehead isn't as wrinkly. But I haven't been there recently. I need to go. So, yeah. Another funny side effect. Those are probably the top cool side effects. Everything else just makes me gain weight. I've yet to get a medicine that's like, oh, may cause weight loss. Mine are all like, may make you eat everything in sight. But I will say the number one for that is Gabapentin. I don't know if you've ever taken Gabapentin before. It's a nerve pain medication. I used to take 9 of these a day. 9 of these nerve pain pills. But then when I got my spinal cord stimulator, I was allowed to cut that down drastically. So I still have to take them. I just don't have to take 9 of them. But if you look up memes on the internet of Gabapentin, they all show like a really fat giraffe. And it was like, take Gabapentin, they said. It'll be fun, they said. But one of the weird things is Gabapentin makes me crave soda. Soda's like just any kind of sparkling soda, water kind of things. But soda's anesthesia. So I don't know, it's like the way anesthesia and Gabapentin affect the brain or the nerves or whatever, but both of them make me crave soda. But anesthesia also makes me crave caramel candy. So I have 5 surgeries planned for the next year, and we can talk about those too. But if you are trying to think of something to send me, just send caramel and like ginger ale. I'll be a happy Albert Stone on anesthesia camper surgery patient. All right, so the surgeries I have coming up or may have coming up, we'll see. The FDA just approved a 2-level disc replacement surgery for the lumbar region. Previously, that was not an option. And for me, we discussed having me go to Germany for a few weeks, but it was going to be almost $40,000 to have that done. And so we thought with the spinal cord stimulator, maybe we could hold off and see what advancements came out for pain. And one of those advancements was at the end of last year, I got called in and told that it had been approved. They were going to do an MRI on my back to see if I was still eligible. And then they would hopefully have me scheduled for surgery in 2023. I went in for that appointment. And unfortunately, the paddle that is attached to my discs in my back to mount the wiring for my spinal cord stimulator, the paddle is not responding correctly. Now, it is functioning. Where the malfunction is on a part of the paddle not related to my particular injury, but it does mean they can't put it in MRI mode. So because of that, I have to have a CAT scan where they put the dye in your spine, and we just don't have that scheduled yet. So they'll probably have to repair the paddle first. So that'll be the first surgery, and then do the double disc replacement in 2023. So those are the first 2 surgeries. Not in that order. The first 2 I'm going to address. The glaucoma eye drops are actually making it so I can't see. It's like one of the side effects, which is pointless. So there is an alternative where they can do a laser surgery for glaucoma. And apparently in like other countries, you do the laser first and then these drops. So I don't know, laser surgery so I can see again properly will be great. So that's the 3rd surgery. The 4th surgery was scheduled for last year. It keeps getting postponed. So now I don't know when it's going to be. But the degenerate bone disease in my spine is also in my thoracic region, and so it causes a lot of pain in the upper part of my back. So we are looking to do a breast reduction. However, after the complications of my last abdominal surgery, where I had a lot of my tissue die, it's called fat necrosis, and also my wound wouldn't heal. So I was in wound care for 5 months, 6 months. That makes me high risk for surgery. So now I'm being referred to OHSU. So it's like the Oregon State Hospital System for more high risk patients. However, my doctor, my surgeon, original surgeon, is still willing to do the surgery. So we'll see what happens to that. So that's number 4. And number 5 is I have an appointment in February, like a pre-something, which is to do the revision from the last surgery where the wound care and the fat tissue and everything died. They have to go in and remove dead tissue and fix the scar and try to just make the whole situation more manageable. So, a couple of those surgeries will, I guess, add a little bit longer to my physical therapy schedule. I guess that's the last thing we can talk about today, physical therapy. I go to Redbird Physical Therapy here in Redmond, Oregon. They're hands down the best doctors of physical therapy, whole patient care, continued care, acute pain care. I mean, you name it. So I've been to physical therapy hundreds and hundreds of times. Like I literally cannot count. For the longest time, I went twice a week. Then now it's an average of about once a week, just to make sure that my body can maintain functionality. And then after each surgery, I go into more of like the post-surgery acute care. And then luckily my muscle memory kicks back in, and then I go back to just functional care. So I've been there so many times. I actually have a Redbird sticker on my car, and my favorite t-shirt is from there. And my doctor is the best. So that might be a sign I go to physical therapy too much. Anyway, she's awesome. And she's given me some pretty funny prescriptions and exercises to do too. But since she does my abdominal work, pelvic floor, all of that, probably won't go into too much detail about what those are. Just Google it. All right. Well, thanks for hanging out for this video. I have just a couple more days until my disability hearing. I'm crying once or twice a day now from the stress, but trying to stay focused on the positive and focused on self-care. Made sure to do my makeup today. Always makes me feel better. And so, yeah. Talk to you in the next video. Thanks for joining me on this adventure. Have a good day.